Did you know that while many of us worry about having high cholesterol on our blood tests, there are actually other markers that are more important for predicting your risk of developing heart disease? Hi, I'm Dr. Patricia Mills, holistic medical doctor, transforming your health with natural root cause solutions, and welcome to the Wild Wisdom Show. Today, we're going to be talking about heart disease risk, why inflammation markers matter more than cholesterol on blood work. Now, this is a very interesting and important topic because heart attacks and strokes are the leading cause of death of people over the age of 50. Even in women, around 45% of deaths worldwide in this age group are due to what's called cardiovascular disease, so problems such as heart attacks. And this risk is even higher in men. Now, cholesterol has always been a big focus, and the general thinking is that the LDL cholesterol is considered to be bad, while the HDL cholesterol is considered to be good. And if you get your blood work done and you see that your LDL is getting too high, your HDL is getting too low, this is very concerning, and your doctor may even start you on a statin medication or other kind of cholesterol lowering medication. But what the research is showing is that another very crucial factor is inflammation, and there's actually markers on blood tests that can be ordered by your doctor that will give you an even better idea as to what your risk for developing cardiovascular disease actually is. Now, what we know very firmly based on various studies, and here in the banner, if you see the video, if that's what you're watching, you're going to see I've put in the references for just a couple out of many studies showing that inflammation increases the risk of heart disease even if cholesterol levels are normal. This is because inflammation damages the lining of the blood vessels when it's present, when you have inflammation in the body. And that can happen due to various different root causes, such as an inflammatory diet, inflammatory stress, lack of enough exercise, things that are toxic in your environment. These things can all contribute to inflammation happening in your body. And when your body becomes inflamed, there are certain tissues and cells that release inflammatory molecules. And these molecules will float around your bloodstream and into your tissues. And at the level of the blood vessels, it'll actually damage the lining of the blood vessels and increase the formation of what are called plaques. And those plaques can become unstable and break off into the blood vessels, causing a clot. It's kind of like damming up the blood vessels so that blood can no longer flow. And when blood can no longer flow to tissues such as the heart, you develop a heart attack. If the blood can't flow to tissues such as the brain, you develop a stroke. So inflammation, having that present, is a huge risk factor for cardiovascular disease and the formation of heart attacks and strokes. So what we need to know is that not only do these inflammatory molecules directly damage your tissues, not just your blood vessels, but other tissues in the body, the inflammation also oxidizes the LDL cholesterol. It basically changes the LDL cholesterol, making it smaller and harder. And that's actually the kind of cholesterol that has been shown to really increase the risk of heart disease. I've done a video before explaining that cholesterol is not bad. Cholesterol is important for the formation of things like your brain and the formation of your hormones, such as testosterone, estrogen, progesterone, and cortisol. It's also important to create the lining of every cell in your body. So it's not so much that we want to get rid of cholesterol, it's that we want to minimize the bad kind. And also now research is showing we want to minimize inflammation. So how do we measure inflammation on blood work? Now, there are various different markers, and some very popular ones are what are called interleukin-6 and high sensitivity C-reactive protein, or HSCRP. Now, the interleukin-6 seems to be more of a study that can be done in the research setting. So it's not easy to get that test through a family doctor. I work in Canada, and I called around to various labs, and none of them are testing interleukin-6. But what they do test, and what I can and do order for my patients, for example, is the HSCRP. And even the American Heart Association recommends measuring HSCRP along with cholesterol in order to determine one's risks. So how do we use these HSCRP results? So the nice thing is that there are cutoffs that can use to determine your risk factors. So it doesn't say whether or not you are going to develop a heart attack or a stroke, but it tells you if your risk is low, moderate, high, or very high. So if your HSCRP is less than 1 milligrams per liter, then you have a low overall cardiovascular risk. The risk of you developing heart attack and stroke is low, not absent, because there are other markers that we're going to get into that also play into the picture. And the thing is that what I've noticed is that when people have inflammation, it shows up in different aspects in their body. So maybe their HSCRP is low, but if we could test interleukin 6, it would be high. And research has shown that that can be the case. So you have to look usually at more than just one marker. You have to look at various different markers and look at the overall picture and the pattern. Is the pattern one of inflammation or not? And I'll be talking about which are the other markers that would be useful to determine a low inflammation pattern versus a high inflammation pattern. But just looking at HSCRP, it is reassuring to a certain extent if it's less than 1 milligram per liter. If it's between 1 and 3 milligram per liter, then you are at a moderate risk. Anything higher than the 3 means you are at a very high risk. Now, if the level is really high, like over 10, chances are that you actually are undergoing an inflammatory reaction that's what's called acute. So let's say you got your blood tested while you were sick, maybe with a viral infection, a bacterial infection. Maybe you did a big workout and then you went and you got your blood tested. So if that's the result over 10, the recommendation is actually to repeat the test in about 3 weeks when the person is feeling well again, and make sure that the test wasn't abnormally high for a short-term reason. But if you have chronic inflammation, that's the kind that contributes to that higher risk of heart attacks and strokes. And that one will be fairly consistent on repeat testing. So that's how doctors and yourself can use these results to determine your risk for heart attack and stroke. Now, the cool thing is that when we use cholesterol and inflammatory markers, these become a powerful duo in predicting the heart attack risk. So the lowest risk are people who have low LDL, so not too low. Again, you want some cholesterol, you just don't want it to be too high. So if you have low LDL plus low HSCRP, then you're in the lowest risk strategy. So that's a low inflammation pattern. If you have high LDL and low HSCRP, then your risk is moderate. It's higher than if you had low LDL. But if you have low LDL and high HSCRP, that's actually even more risky than if you had the high LDL and low HSCRP. So again, the inflammation seems to be the most important factor, but LDL is important. And the people who have high LDL and high HSCRP are in the very, very high risk category for developing conditions in the future, such as heart attacks and stroke. Now, remember I mentioned that there are other markers that we can take into consideration to see, is there an inflammatory pattern going on here? And so other markers include homocysteine, triglycerides, which are kind of fat in the blood, apolipoprotein B, which is a component of different kinds of cholesterol, and that oxidized LDL that I mentioned before. Now, your doctor can easily order the homocysteine, triglycerides, and apolipoprotein B in most cases, and in most countries where there's public health insurance, it's covered, such as in Canada, and if you have that insurance in the US and other countries. But the oxidized LDL is harder to get, and usually you have to pay for it out of pocket, and you have to go through a specific laboratory that does that testing. So, for example, in Canada, the average laboratories who do the testing of regular blood work for doctors generally don't do oxidized LDL. So that's testing through a functional medicine doctor or a naturopath who has a connection with those laboratories that do specialized testing in oxidized LDL. But you do not need to test oxidized LDL in order to determine your risk. It's enough to look at your LDL cholesterol, your HSCRP. That's a really good starting foundation. It's even better if you know what your homocysteine, your triglycerides, and your apolipoprotein B are. And if you're noticing a trend in most of those markers being high, even in the high normal range or above normal, then that really should motivate you to look at what's going on with your lifestyle and your exposures that could be triggering inflammation. So it's rare that someone has all of these markers really high, but if you do, obviously that's a big problem. But if you're noticing like a couple of those being high and outside of range, that really already puts you in the high risk. If all you have is a high LDL and everything else is normal, then you're in the moderate risk. And if everything is normal and within range, then you're in the low risk. So the take home message here is that your blood work should really be a motivational indicator of whether or not you need to take an in-depth look at your lifestyle and lowering inflammation through nutrition. So an anti-inflammation diet, which is typically a whole foods diet, very low to absent ultra processed foods, having enough sleep, having enough movement, not too much and not too little exercise, managing your stress, because stress, physical, mental, and emotional stress does increase inflammation. And sometimes there are optional supplements that can be helpful. And interestingly, the supplements that lower cholesterol also lower inflammation. So I'm going to put in the caption below this video, if you look below this video and look at the writing underneath it, and sometimes you have to click on the more button to see it all show up, I'm going to put a link to my high cholesterol playlist where I've put tons of videos in there covering all of these root causes from every angle with natural solutions and strategies that you can start engaging in right away. And what I can tell you is that just recently I had a couple of follow-up appointments with my group medical programs, and I tend to see people in groups because that's really the very powerful way to get people motivated to change their lifestyle. And in each group, I have about 8 patients. And in the last 2 groups, so 16 patients, all of them had high cholesterol. And on follow-up, after engaging in all of these strategies, all of them experienced a lowering of their cholesterol without the use of medication. What that shows me and what that showed them, and I see this over and over again, is that these strategies work. Now, for some people, medication is necessary. It may be a short-term need. It may be a longer-term need. If you're someone, for example, with familial hypercholesterolemia and you've tried everything and nothing really is working, and so that medication is necessary, in which case, by the way, if you need to be on a statin medication, you should be on a coenzyme Q10 supplement to offset the very real adverse effects that can happen if you're not. That video is also in the playlist. But what I really want to motivate you and encourage you on is to look at this as a signal. It's like the fire alarm is going off because there's a fire going on. And if you just use medications to put out the fire alarm, to turn off the fire alarm, but you don't address the fire, the underlying inflammation, sure, your cholesterol might look better over time, but you may still experience really bad things going on with your health because of that underlying inflammation that continues. So addressing inflammation from every perspective is so key. And so definitely please check out that high cholesterol playlist and explore my channel. I also have an inflammation playlist talking about the anti-inflammatory diet and other strategies. So make sure you go through those and listen or watch whatever works for you. And if you're on podcast and you're wondering where these playlists are, they're on my YouTube channel. And that's at drpatriciamills on YouTube. If you enjoyed this, the best way you can support the show is to subscribe to my YouTube channel, save this for future reference, and share this episode with someone who you think might benefit. You never know when someone's going to benefit from this wild wisdom, and sharing is caring. Thank you for joining me today. I hope you have a wonderful rest of your day, evening, or night, depending on when you caught this, and I'll see you next time. Bye now.